Welcome to Meaningful Mondays with the Community Foundation of Middlesex County, where we only know good people who do great things in our community. Whether you are a volunteer, a donor, or a nonprofit organization, each episode of Meaningful Mondays will celebrate you, our friends and neighbors who have a deep passion for and commitment to improving the quality of life for all in Middlesex County. So let's kick off the week with great conversations with remarkable people, businesses, and nonprofits making a difference right in our own backyard. Good morning, everybody, or good afternoon, whenever you're listening to this. Welcome to Meaningful Mondays with the Community Foundation of Middlesex County. And I have to say, this is one of the most meaningful chapters of what we're doing. And ladies, I can't thank you enough because you are our heroes or heroines, whichever. But I think you wear capes. And when I say that, let me introduce the people that we have here. Dr. Andrea Malon, who is with Middlesex Health. And Andrea, you are the director of Middlesex Health Cancer Center. Thank you for being here. I know how busy you are. And then we have Dr. Kertrisa McWhite, who has lots of information about her personal life that I found fascinating. But the most important thing is that you are taking care of the women that we really care and hold dear. So thank you for using your expertise and talents to keep us healthy. And last but certainly not least is Lynn Alston. Lynn, I think you wear a cape because you reach out into the community and you fly all over Middlesex County and help bring folks into these technical experts. So if I may call you Dr. Malon and Dr. McWhite, I'm going to lead off with just saying that what shocked me with some of the information that, and shame on me, I should have known that breast health is so important. I know that, but I didn't realize that breast cancer ranks second after lung cancer as a cause of death in women. And ladies and gentlemen, I want you to listen to these experts, and I want you to make sure that you are taking care of your breast health every single day. So, Andrea, may I lead off with, or whoever wants to answer, why is it important? I know it's important. It was drilled into me. Just give us some general facts and information.
Sure, I'd be happy to. Thanks for having me. So as you were saying, Cynthia, breast cancer is the second leading cause of cancer death in women, but it's actually the most common cancer in women. So lung cancer is a higher death rate, which is why it accounts for more deaths. But breast cancer is the most common cancer in women, and the average lifetime risk is about 13%. And what that translates into is approximately 1 in every 8 women will be diagnosed with breast cancer over the course of her lifetime. Now, that's the bad news. The good news is that if found early, breast cancer is highly, highly treatable. And over the past couple of decades, our death rate from breast cancer has dramatically declined. So if you go back as far as 1989 or so, our death rate has declined by over 40%. So we're doing really well treating breast cancer. The earlier we find the breast cancer, though, the better our chance of curing that cancer. So if we find the cancer when it's just confined to the breast, meaning it hasn't traveled to any other part of the body, we have really, really high cure rates in the high 90, 98, 99%. If we find the cancer when it's traveled from the breast to nearby lymph nodes, then we are not quite as good as curing it, but still very good with cure rates in the mid to high 80%. Our biggest challenge is if we don't find the cancer until it's already spread to other parts of the body, that is a much bigger problem in terms of our cure rates, and we can see those numbers just drop off. So the most important concepts that I'd like everyone to remember are that it is really, really a common disease, but that it is really, really curable if we find it early. And our best chances of finding it early is by doing routine evaluations, including mammograms when people are of the right age for mammograms.
You know, when you said 1 in 8, is that the right statistic? I'm a multiplier because
Yep.
that affects 1 woman out of 8, and then you consider the woman's family and the multiplying effect that it has on the rest of the family and the rest of the community, quite honestly. So thank you for that. And Dr. McWhite, signs, symptoms, I'm going to go back to Dr. Malon. I think the hopefulness that you gave us in the statistics, I hope that we can market that more than seems to be marketed throughout the county, because I think there's still a lot of fear and there are a lot of myths, but we'll get into that later. So sorry, Dr. McWhite, I'll go back to you. Signs, symptoms.
So one of the most common and obvious signs is going to be a palpable breast mass. Either a man or a woman has examined themselves and detected something during a focused exam, or they're taking a shower, rolling over, leaning to hug someone, and notice something different about the breast and feel a lump. A palpable mass should prompt follow-up with your physician. Most palpable masses are not going to turn out to be breast cancer. That's really important for patients to know. Don't jump the gun if you feel something. Don't, raise all the sirens. Hold on, let's, do some things and figure out what this is, because again, not all masses are breast cancer. Some other signs include thickening of the skin. Sometimes the skin of the breast may take on a puffy or orange peel appearance. That's something that should prompt follow-up by your physician. If you develop redness of the breast that you think might be an infection, but it doesn't resolve on its own, or especially if it doesn't resolve with a course of antibiotics, further evaluation may be needed. And then the final sign I'll mention is bloody nipple discharge. Nipple discharge is quite common. Any color other than bloody discharge is typically going to be harmless and benign, but bloody discharge should always have you seeing your primary care doctor and being referred if necessary.
So if you see any of the symptoms, the first person you should reach out to is your primary physician.
Yes, you should reach out to your primary care doctor. They'll determine if any imaging is needed, if so, what kind, and then they will refer you appropriately to one of us if that's needed.
Thank you for that. That's really very helpful. Would you just repeat like the three or four things that you said? Because I think that's so critical. We don't hear that in any of the commercials that we see, and I think that really is important for all of us to try to remember. And I know me, I need to hear things several times.
Yes. So again, feeling a mass in the breast, experiencing thickening of the skin, puffiness of the skin, retraction of the skin, including the nipple, redness of the breast that doesn't resolve in a reasonable amount of time, especially if it doesn't resolve after a course of antibiotics, and bloody nipple discharge.
Thank you very much. What part does genetics play in all of this?
So the majority of women who are found to have breast cancer do not get it because of their family history. So I'll say that again, because even when I say that to people face to face, it's hard to understand. The majority of breast cancer does not happen because of our family history. So many women assume they're never going to get it because no one in their family had it. And many women who even have one relative think that they're destined to get it. And both of these are wrong concepts. Only about 1 in 10 women get breast cancer because of their family history, meaning of all those. Which means that the vast majority of women with breast cancer do not get the breast cancer because of their family history, which means that we're all at risk for breast cancer, which is why everybody needs to be aware and keep an eye on their breasts and see their doctors, and at the appropriate age, get mammograms. Because what Dr. McWhite said is correct, that you need to evaluate these findings. But if you get your mammograms regularly when you're over age 40, then hopefully if you were to get a breast cancer, it should show up on your mammogram before we can even feel it. So again, genetics plays a role for some people. The people we're worried about for genetics are people who are found to have breast cancer at a really early age. The average age of diagnosis is in the 60s. I've seen women as young as 21 come down with breast cancer, and women as old as 101 show up with breast cancer, but average age is in the 60s. But if people are getting it at a young age, genetic evaluation is appropriate, or if there is a strong family history. So if people have multiple family members with breast cancer, then genetic evaluation is appropriate. And there are geneticists that people can speak to determine whether or not they should undergo genetic testing. Genetic testing is just taking a blood sample and having your DNA evaluated to see if you're at increased risk for breast or other cancers. Once we identify women as being at increased risk, let's say because of their family history and DNA, then there are measures we can take to improve the chance of finding the cancers at a curable point.
Well, you dispelled one myth that I thought I knew, that genetics does not play as much a part as I thought it did. So thank you for that. You are going to have to come back, because I'm going to have so many questions after we finish this. So that was one myth that I had. What are the other myths that you come across and you're trying to dispel?
So I think one of the biggest myths that I encounter that really impacts patients' outcomes is something I alluded to earlier. Not every lump that a woman detects in her breast is going to be a cancer. I have met many patients who say, "Oh, I don't do those, self-exams because I scare myself every time, and I know if I feel something, it's going to be cancer." That is the opposite of, the truth. Really most lumps, we evaluate them with imaging and or needle biopsy, and they turn out to be benign. So, get that reassurance by being followed up appropriately. One of the others that Andrea just alluded to is that if you have no family history, you don't have any risk for breast cancer. As she said, only about 10% of patients that we see have developed their breast cancer as a result of a genetic mutation. Another common one is that needle biopsies may spread the cancer. That is not the case. It is safe to have a biopsy. If it's cancer, the cancer will be removed. The needle does not spread the cancer. If we go to surgery and the cancer is present, can the exposure to air cause that cancer to multiply and spread to other parts of the body? That's a common one that I hear very often. That is not true. If a patient is undergoing surgery for breast cancer, and later on, maybe even shortly thereafter, cancer is discovered elsewhere in the body, it was already there. We just didn't detect it prior to surgery. Maybe it was too small to pick up on imaging or through blood work and that sort of thing. Breast cancer is not necessarily a fatal disease. Patients come in thinking, I have a very small breast cancer, but this is going to be the death of me. And as Andrea said, these early cancers that we catch have an extremely high rate of cure. Breast cancer does not have to be painful, and patients who are older in age should continue to have clinical breast exams, so an exam by their primary care doctor, OB, nurse practitioner, as long as they are healthy enough that they might want to do something if a breast cancer was discovered. For some people, that might be age 70. For someone else, it might be age 95. So important that you know these facts so that you can be proactive about your health.
You know what, Dr. McWhite, what you just said was so important, because one of the things I wrote down that wasn't on a bullet that we've shared amongst each other was fear. And I think there is lack of education and lack of knowledge. You are the ones who have it. And quite honestly, sometimes, and I did say this, we put you on a pedestal and you are the experts, but it's the fear of the unknown that really, I think, really gets you, which is where you come in, Lynn, because you're the lady with the cape that's out there doing the community outreach. So tell us. And I have to tell you, I'm so proud of Middlesex Health anyway, but I was so proud because I did not know that Lynn's role existed. And I just think it's magnificent that we have someone like Lynn that's out there doing the community outreach and education. So Lynn, it's your turn to brag.
Well, I'm out in the community, so I'm mainly doing community outreach, going to health fairs. I will attend senior centers. I reach out to churches. I reach out to any organization in our footprint, which is Middlesex County. Depending on what the event may be, sometimes I'm limited in, time to be able to share. It could be 5 minutes, a full presentation with me coming to a location usually is about 20 to 25 minutes. So we sit and have the same conversation, you know, explaining some of the fears that people do. And I find that more than anything else, the symptoms to look for. And I do have a handout so that when you leave, you have something to read. My biggest thing that I do is I am quite transparent. I walk this because I've been there. I have had 4 lumps that have, you know, been benign, but I understand the fear more than anything else because my second surgery was a little bit more intensive. I am very happy to be a part of this team. And what I love is Dr. Malon and Dr. McWhite educate constantly. And that was important to me when I had to have my first surgery. I had a surgeon who did a lot of explaining to me so that I understood. So I want other women to understand that it is so important every month to do your self breast exams. And more than anything, that yearly mammogram. My other part that I do explain to folks, if there's a barrier in your way that's preventing you of going to the doctors, to having that physical so that you can get your clinical breast exam, or if there's something in the way that you're not able to get the mammogram, that's the other part of what I do. So depending on what the barrier is, sometimes it's something that I can assist with. If not, we have social workers here at the Cancer Center that I'll hand off, but follow to make sure everything's going okay and make sure that we take that barrier out of your way, because we want to make sure that you're getting the care and your breast care along with your regular physical care. The other part that I love is that I'm available to Dr. Malon and Dr. McWhite if there's a patient that by chance is leery, afraid to go to their exams, afraid to go to their treatments. I'm the buddy. So I'll be happy to accompany them. I'm here at, you know, just part-time, but I'm here available to have those conversations. Just, it's a different conversation. I'm not clinical, so I'm your best friend, and I'm willing to hold anybody's hand.
You wrap everybody in a warm blanket, don't you?
I try to.
You really do. So, you know, I'm just going to throw this out. Is there a question I should have asked that I haven't asked? Because now in the back of my mind, I'm coming up with 20 bullets that we need to do in another podcast. So seriously, I do think the fact that you have taken down the barriers, that you have a buddy like Lynn who can help folks who might need a warm blanket or their handheld, that you've educated us. I guess I'll ask, what drives you crazy, ladies? Is there anything that drives you crazy where you wish you could shake us by the shoulders as women to say, please do X, Y, and Z?
I think from my perspective, it sort of circles back to many of the things we talked about, but it's that I still see people coming in with very large lumps in the breast where already the skin is broken down and it's a really big mess. And clearly that woman has known about it for months to years, but has been afraid to reach out. And there, you know, when we find that patient at that situation, we're way behind and our cure rate's not going to be good, and we're going to need more curable treatment. So if we find breast cancer early, then most women do not need their whole breast removed, and most women don't even need chemotherapy. So when we find it early, it's typically outpatient surgery and maybe some radiation to the breast, which is tolerated really well, and maybe some pills. But if we don't see that person until it's really advanced, then it's a much bigger problem for us to deal with, and it's much more of a problem for that patient.
Oh my gosh, Dr. McWhite?
I think the thing that I find most frustrating is the patient who is educated but doesn't put themselves first. And what I mean by that is, you know, she may say, you know, I knew something was going on, but my kids needed this. For work, I needed to do that. For my spouse, you know, I needed to take care of this other thing. And so, you know, the time got away from me. You know, we're on the clock. if the lump that you feel is a cancer, we want to address it as early as possible, so that we can treat it, causing the fewest side effects possible, and hopefully affect a cure without putting patients through extensive treatment.
One of the best pieces of advice I ever got was, remember, you have to take care of yourself. If you're on an airplane and it's going down or something's going wrong, put your mask on first, because you can't help anybody that's there beside you if you're not able to take care of yourself. So I guess the message I will give out is, ladies, please put yourself first, because we all need you. Your families need you. You know what? I really do think you wear capes. I really appreciate that you've demystified some of this about breast cancer, and that you've underscored the fact that we all as women need to take care of our breast health, and men too. Because then we can take care, and I'll be selfish, we can take care of the community even better than we have. But I'm just going to, because sometimes we're afraid of doctors. Sometimes we need to ask just a few personal questions, if you don't mind. And if you do mind, we'll edit it out. So, Dr. McWhite, you're into sci-fi, you're into antiquing, you're into camping, and you are a surgeon. What else do you do in your spare time?
I probably watch way too much sci-fi on TV. And I also enjoy reading. So you will almost always find me with my phone up to my face, but I'm not on my phone playing a game. I'm usually reading a book.
Good for you. I love reading. Andrea, how about you? What do you do?
I also love to read. You'll find me usually listening on my phone. I listen in my car, even when I'm driving here and there. So I do enjoy reading. I do enjoy spending a lot of time outside, as much as I can, some hiking, some skiing and the like. And I have a very large extended family, and I seem to always be doing something with, for, or about somebody in my family. So.
But you're putting yourself first, right?
Always working on that.
All right, good. And Lynn, how about you?
I'm really active in my church, so those opportunities are there. And if it's not church, I have 5 grandchildren. So grandma is always busy with some grandchild.
Good. So I have to do a shout out to Middlesex Health. We're having 3 brilliant women who are there taking care of the rest of us in the community, and for really being forward thinking and thinking of solutions and removing barriers. And so I applaud all of you. And I'm probably going to cry and my mascara will run, but we'll edit that out. So just one last question. What are you all looking forward to in the next couple of months? And I'll start with you, Dr. McWhite.
If you mean outside of work, I'm looking forward to some sunshine and not humid days, and my daughter's upcoming graduation from high school.
Oh, good. Well, yes, we're all looking forward to sunshine, aren't we?
Mm-hmm.
Andrea, Dr. Malon?
Oh, same thing. I love to get outside. So as the weather's turning nicer, it's very difficult to be sitting in my office. But yes, getting outside. And as I said, a lot of family things. We have a family wedding coming up. We've had 2 recent babies in the family. We have a family reunion every summer. So a lot of things of that nature.
Good. And Lynn, how about you?
Well, mine's not going to be outside of work, because now that the weather's becoming nicer, this is my busy season. So Lynn is looking forward to more community outreach, more conversations, and just hitting as many health fairs as I possibly can.
Well, thank you. Thank you all for being part of Meaningful Monday. You really made Middlesex County meaningful every single day. We appreciate all that you do.
Thank you.
Thank you for having us.
My pleasure. Thank you for joining us for this week's episode of Meaningful Mondays. At the Community Foundation of Middlesex County, we know that philanthropy matters and philanthropy works. Together, we support the arts, education, human services, animal welfare, the environment, heritage enhancements, and so much more by providing services, programs, and grants to our local nonprofits. We invite you to learn more and share your passion with us. Visit us at middlesexcountycf.org or or contact us at 860-347-0025. Together we can make great things happen.